segment brought to you by the Nashville Pet Emergency Clinic.
The phone lines are open, and veterinarian Dr. Craig Pryor joins us now to answer your questions. As always, thank you for being with us.
My pleasure.
All right now we've got Deborah. Deborah, thank you for watching. You are on the air live with the veterinarian.
Hi, I have two dogs, and they seem to have a yeast-type ear infection.
Okay.
I have antibiotics, and it goes away very quickly, but then in a couple of weeks it comes right back.
Okay, so antibiotics typically don't treat yeast. They just, you actually need an antifungal drug to do that. But yeast infections in dogs' ears tend to be secondary to something else. So there could be a primary infection and you're getting the yeast as a secondary infection coming through. Sometimes we see allergies cause it. Sometimes we see food allergies cause it. So I would, obviously you probably need to go in for a recheck with your regular veterinarian and just mention to them you're still having these type of issues and see what they want to do. But that's probably what's going on. Something else is causing it.
All right, Barbara, thank you for watching. You're on the air live with the doc. Hey, Barbara?
Uh-huh.
You're on the air live. Go ahead and ask your question.
Okay, I have two Pomeranians, and I took them back at the end of June to get them trimmed short.
Yes.
And the black one's hair has not come back.
Right. So what's causing that? A couple of different things can do it. You sometimes get what we call a post-grooming alopecia, where the coat kind of goes into shock and says, oh, I'm not going to grow. And time will be the telling factor that will grow back. Occasionally, older dogs have a thyroid issue, and the hair will stop growing as much with the thyroid issue, and that's a blood test your regular veterinarian can check for you. So I would maybe just call and just talk to them about it and see what they want to do. They may need to see you. They may want to give a little bit more time, but that's a couple of things that could be going on.
All right, we've got Carol with us right now. Carol, thank you for watching, and go ahead.
Yes, I wanted to ask him, my cat Cody is on special medicated cat food for urinary infection. The urinary infection is cleared up and everything, and I wanted to know if it was okay to mix, like to give half of the cat food, the medicated kind, and then the kind that you buy at the store. Can you make half and half and it'll be okay?
So I would not think of it as medicine in a bag. This is stopping your kitty from getting sick and you having to go to your regular veterinarian and spend money to get your kitty treated and fixed up. So when I have a cat that has a urinary issue and have changed their diet, I recommend you just put them on that and keep them on that. And I typically say that it means that you're not going to have to come and see me again, we hope. So I think you're playing with fire there. I wouldn't change the diet.
All right now we've got Ann with us. Ann, thank you for watching, and go ahead with your question.
Yes, I was calling to see, you have the dog groomed and you even give him a bath yourself. Is there anything that you can do to it to get rid of that doggy smell?
So if you're using a proper medicated shampoo, it should definitely help. But if you're still getting that dog smell there, maybe something else going on. Occasionally the anal glands are the issue and you need to have the anal glands emptied. There may even be a skin infection going on. So if you can't get rid of the odor, I'd recommend maybe you go see your regular veterinarian and just see if there's nothing else that could be done to help you out.
All right, going to get one more in. Amanda, if you will, quickly ask your question.
I'm just wondering, I have a 3.5-year-old little pit bull, and his breath is horrid. I give him natural food. I put coconut oil on his food. I've tried brushing his teeth, and it's awful.
Yes, so 90% of dogs over the year, age and a half, dogs and cats, developed dental tartar and halitosis because of that. So, it's one of those things that you probably need to consider getting their teeth clean. That's going to help you out. But even doing that is going to redevelop unless you start doing regular care. And you need to look at using some dental chews, oral rinses, there's TDs, there's special dental tartar food, things like that, and make sure he's not getting into the cat poop in the backyard because that'll make his breath smell terrible in no time.
I hate it when that happens.
I know it.
As always, thank you very much for being with us.
My pleasure.
Today. If you'd like to get in touch with Dr. Pryor, you'll find his contact information on our website at newschannel5.com.